Tonight, Erase Racism presents its Corporate Leadership Award to the North Shore-Long Island Jewish Health System. There's a full-page description in the journal which describes why North Shore-LIJ is so worthy of this award. One of the issues high on Erase Racism's agenda is the racial disparities in health outcomes that are created by differential access to quality health care and public health services. North Shore-LIJ focuses heavily on this issue. It recognizes its obligations to the diverse community it serves and is committed to promoting, sustaining, and advancing an environment that supports the principles of equity, diversity, inclusion, health literacy, and community. To demonstrate its commitments to these principles, in July 2010, the health system and the Hospital North Shore-LIJ School of Medicine established the Office of Diversity, Inclusion, and Health Literacy, headed by Dr. Jennifer Mieres. This initiative recognizes the diversity of the New York metropolitan area and the need to promote effective communication to eliminate health disparities and enhance patient outcomes. Being sensitive to cultural beliefs and customs, both among patients and fellow team members, is a critical component to achieving the health system's mission to deliver quality care to patients and families throughout its hospitals, its 15 hospitals, and more than 20 ambulatory care centers and other programs. The North Shore-LIJ Health System is committed to excellence and equity in healthcare for all the people it serves. Carrying out its mission supports the advancement of equity, diversity, inclusion, health literacy, and community. It is for this reason that Erase Racism has selected the North Shore-LIJ Health System to receive our 2012 Corporate Leadership Award. Here to accept that award is Dr. Jennifer Mieres. Dr. Mieres.
The Board of Trustees and the entire North Shore-LIJ Health System. Sincere thanks to the leaders of Erase Racism for this award. We at North Shore-LIJ applaud Elaine Gross and the Board of Governors and the directors and the team at Erase Racism for their continued commitment and tireless efforts on the long journey towards the elimination of all racial disparities, including those in the world of healthcare. Thank you for reminding us that there's a continued need to focus on the disproportionate burden of chronic diseases among people of color. When you think about it, in 2012, we have made significant advances in our abilities to diagnose disease, to treat disease, due to advances in medical technology. But when you take a look at the most recent statistics from the Center for Disease Controls, you can see that in all of the chronic diseases, people of color are at high risk for death and a higher prevalence for diseases such as heart disease, diabetes, complications of obesity. So in 2010, as you heard, North Shore-LIJ decided to formalize all of the diversity, inclusion, and health literacy efforts into the Office of Diversity, Inclusion, and Health Literacy. This was taking our commitment one step further to really have a foundation and a group of people and a team working on strategies to include diverse and inclusive thinking, but more importantly, to foster a partnership with our communities to truly figure out strategies to eliminate disparities in health. On a personal note, I was truly privileged and honored to temporarily hang up my stethoscope as a cardiologist and assume the role as Chief Diversity and Inclusion Officer for the health system. For many, many years, and for those of you who know me, I I have been a true patient and community advocate, and have really believed in building strategies where we can foster a true 50-50 partnership with all of our patients. And I am honored to have the privilege to have this platform to be able to lead those efforts for our health system. As we expand our community partnerships, it is our goal to engage and empower all of its members to be active participants in their own health. We believe by educating, by speaking in a health-literate way, we will conquer and provide access for everyone and really conquer chronic diseases. We also believe that by focusing on communities at greatest risk and building true multi-sector partnerships with key organizations such as Erase Racism, opportunities to fully eliminate disparities in healthcare will become a true reality. So ladies and gentlemen, I want to applaud Erase Racism for honoring us tonight, but more importantly, for reminding us and encouraging us to be partners as we work together to eliminate disparities in healthcare and provide culturally and linguistically appropriate care for all of our citizens. Thank you very much for your attention.